Okay, so I'm gonna go over the stethoscope basics for you guys. This one that I'll be demonstrating with is probably one of the most common ones in nursing. It's a Littman Classic 2 SE. There are tons of different types and at different price points. The mechanism is mostly the same, so I'll just speak to this one, and you'll want to actually review the user manual that comes with your stethoscope to sort of see what the differences are if yours is a little bit different. So the main anatomy of the stethoscope is down here. This is the part that you'd place on the patient. So you have your bell is the smaller side, and the diaphragm is the larger side. And they're used, they can be used interchangeably. You can flip it to whichever side you want. The diaphragm is a little bit better for higher frequencies, and that one is more commonly used actually, and whereas the bell is a little bit better or easier to hear lower frequencies. Then you have the tubing, and this is what transmits the sound. So you'll notice that the tubing is rather thick. You want to make sure a new one out of the case wouldn't have any cracks or anything in it, hopefully. But you want to try to keep your tubing nice and intact over time. You don't want to bend it up or coil it up too tight. And a good idea, I have like a little bit of a chain here with my initials on it. They do sell, or sometimes they come with your stethoscope, a little attachment piece to put your name on. Some people do actually engrave their stethoscopes with their name too. You could do that too, just so that you don't lose it, or if you do, you know it's yours and you can get it back. And then you have your earpieces up here. So that's the part obviously that goes into your ear. So when you put it into your ear, you'll notice that there's a bit of an angle to that. You want to put it into your ear so that it angles down towards your nose. So it just fits nicely into the ears. A lot of the newer ones come with different sizes of earbuds on them, so you could change that out if you wanted to too. But just want to make sure that when you're placing it so that it follows your ear canal, so the conduction of sound is best. So down towards your nose, always just remember that. So when you put it on for the first time, you could give it a little tap on the diaphragm, and that's how you'll know if it's on, if you hear that gentle tap inside your ear. If it doesn't transmit a sound, just flip that over and you'll hear it click, and then you'll hear it transmit the sound again. So that's your stethoscope being on for diaphragm listening. So we'll just review the basics of, I should say, your stethoscope you'll find you use for a lot when we're talking about assessment. And you may have had this done to you before in the doctor's office, but you use your stethoscope or will start to use our stethoscopes to listen to chest sounds, or breath sounds, respiratory sounds. Those all kind of mean the same thing. You'll also listen for bowel sounds, so to hear that bowel functioning. You'll use it eventually to listen to heart sounds, so listening to the different heartbeats and different heart sounds, and listening for murmurs. You can also use a stethoscope to listen to blood vessels, so you will learn eventually about bruits and thrills, and we will listen for those and teach you guys how to use it for those kinds of things. So just those are the basics.